Hello, my name is Tyson Spring. I'm a clinical herbalist, and I would like to talk to you today about vitamin D. Vitamin D is a very overlooked nutrient. It is a vitamin, but it's also a hormone, probably more so on the hormone side. It's definitely something our culture overlooks a lot. It's one of the main deficiencies, if it is actually the biggest deficiency. Around 80 to 95% of all Americans, depending on the survey, are deficient in vitamin D. That's a lot. Vitamin D is very important. Um, it can be used for just general pain, and it's also one of the most important mechanisms in the inflammatory response as far as having an anti inflammatory effect. There are many conditions that have inflammation as one of the main mechanisms involved, and vitamin D can be very helpful in so many different chronic conditions. A few of them, for example, are Alzheimer's. And this happens because, well, it happens for lots of reasons, but one of the reasons why people get Alzheimer's or dementia is because they actually get inflammation in their brain. And vitamin D, if you do not have enough vitamin D in your body, you're going to be way more prone to inflammation throughout your entire body, including your brain. And that's very important. Um, Vitamin D is also showed in high doses to have amazing benefit in autism as well, believe it or not. Um, it's also really good for cancer as well. In fact, some people have even gone as far as saying that cancer is a vitamin D deficiency. Now, I wouldn't necessarily agree with this because I think there's more going on than vitamin D being deficient, although the deficiency in vitamin D may be a huge factor that is overlooked. So, generally, when it comes to autism and sometimes cancer, people like to push the vitamin D level up past 75 nanograms per milliliter. And that's a little controversial because 75 nanograms per milliliter is what your body naturally absorbs from the sunlight. So, in other words, when you're outside and you're getting sunlight, the sun's coming from obviously from the rays are coming from the sun and they're coming down onto your skin and they're penetrating your skin and they're mixing with the oils in your skin before it actually is vitamin D. And then it turns into vitamin D and it's absorbed into your skin. But at a certain point, your body stops absorbing it. And once your blood levels reach 75 nanograms per milliliter, your body actually stops absorbing more of it, believe it or not. And so it has a self regulating system. So to go past that is somewhat controversial, although it is possible naturally to go past that because there are things like fish, eating fish, and mushrooms that have vitamin D in them. So you could potentially get your max amount of vitamin D from the sunlight and then eat those foods to make your vitamin D level go past that naturally. So it is possible that the body was taking that into consideration when it had a cutoff at 75, considering that it could go higher, but just to be safe, it would cut it off at that side. That's controversial. The other thing is that a lot of medical doctors don't actually ever bring it up to 75 nanograms per milliliter. Um, that's just kind of a preference where medical doctors they don't really think that it's necessary to do so, and so they really just don't push for that. And if you have like around 50 nanograms per milliliter in your blood, they're going to say, oh, that's great. You're doing great. You do not need to take any more. But I would say 75 nanograms per milliliter is your max potential. So why not go for your full potential, especially because it has so many benefits. Some of the things, some of the things that I have left out is actually bone health and how vitamin D actually regulates your bone density, and it helps the magnesium and calcium to be regulated in your bones to make your bones stronger. So without vitamin D, you're going to develop weak bones. Um, the thing about vitamin D, though, is that if you don't get enough vitamin D, you're going to have bone loss. But if you get too much vitamin D, you're also going to get bone loss. If you go past 100 nanograms per milliliter in your blood, you are more prone to it. Some doctors who are pushing it for extreme causes, rare situations where people have cancer or autism or something along those lines, the doctor may push it up to 120 nanograms per milliliter in the blood. That's the highest I've ever heard of it ever going. And that's not a general practice, and your standard medical doctor would be shocked to hear that, most likely. So don't ever try and go up to 100 nanograms per milliliter. And the way to test this is to go to your doctor and have a blood test for vitamin D, and that you will get a lab report back. And when you do, um, ask for the actual numbers, because the doctors are more likely to just say, "Oh, you have healthy levels," and leave it at that, when you really may not actually be as high as you could be with all the benefits of it. So vitamin D is accumulative in the body. So you can actually take a lot of vitamin D at once. Um, and it's not going to be an issue because the levels in the blood are not determined as much how much you take at a single time at once. It's more an accumulation that builds up over time. So you can take pretty hefty doses. Um, Another thing about vitamin D3 is that it's really important for all sorts of chronic conditions. Besides for what I've mentioned, just chronic conditions across the board, because inflammation is involved in so many different things these days. Another chronic condition that's really important is multiple sclerosis, which has, it's kind of rare, but it just goes to show how important vitamin D really is. And that is, people with MS, multiple sclerosis, are way more likely to have it if they live in areas where they have less direct exposure to the sunlight. So if the sun is not directly above you for most of the year, and it's further away, in places like where I live in Oregon, most of the time the sun is not directly above. It's usually to the side, and that indicates that the sun has to travel through a lot of the atmosphere before it gets to your skin. And so a lot of the potential dissipates before it gets to you. So you are probably better off supplementing than trying to get extra sunlight, because no matter how much sunlight you get, you probably are not going to be able to get enough if you live in those sorts of areas. And those are the same areas where multiple sclerosis is the most common. Multiple sclerosis is a pretty horrible condition where the synapses in the brain are not able to go through, usually due to damage to the myelin sheath. And for whatever reason, vitamin D significantly improves those situations. And so you could have someone who can't move their arms, and they have trouble talking because the signals from the brain aren't going to the muscles, and vitamin D can be very beneficial for that. Um, as far as getting your vitamin D from the sun, another reason why it's important to supplement is because when it comes to the skin, the sun rays, the, like I said earlier, you'll start forming vitamin D in the fat on your skin, and it actually takes a while, up to like 12 hours for it to absorb into your skin and actually be usable. So if you happen to take a shower and wash it off with soap, soap is specifically useful because it gets rid of oil a lot, as otherwise you would just rinse off, but because it's oil, it takes that off, and so you can potentially clean yourself of the vitamin D, and that can obviously deplete your levels. So vitamin D3 is what the body converts the sun rays into, whereas vitamin D2, which you'll see a lot of milk is fortified with vitamin D2. A lot of foods say they have vitamin D in them and they have vitamin D2. And that's good. The body can convert vitamin D2 to vitamin D3, but the type of vitamin D that mammals naturally produce is vitamin D3. So it's probably better to take vitamin D3. And there have been a few cases where it's indicated that it does work slightly better. Vitamin D is also really important for the immune system, too. If you have a weak immune system and you get sick all the time, it could be due to not having enough vitamin D. If you ever heard of SAD, seasonal affective disorder, it's where you get um, depleted and you just don't feel very good, and your energy levels go down, and you feel kind of sad. Um, and that's due to a lack of vitamin D. That happens in the wintertime. Um, as far as the immune system goes, vitamin D3 is actually used somewhat in a controversial way sometimes to abort a flu. So this is where it gets more controversial, and a lot of people are not willing to take this sort of dose, and I totally understand because it is a pretty high dose, and there's a lot of websites saying don't do that. So, you know, I understand that it is a little daunting to do, although it has been shown many times to be perfectly safe as long as you don't take this dose for a long time, because it is accumulative the way that vitamin D works. So it's not like taking a whole bunch at once is going to cause you a bad issue, but taking a whole bunch at once over and over and over for a long time will build up and it will cause serious problems like bone loss. So I've done this myself where if you happen to have a flu, you can take, and this is a high dose, but 1,000 IUs per every pound of body weight that you weigh. So that's going to be how many pounds you weigh, that number, times 1,000. And that's how many IUs, international units, of vitamin D3 that you're going to take. And you're going to do that for 3 days or until your flu goes away. After 3 days, I would recommend to back off, because if it's not working by then it's probably a bacterial infection or a fungal infection or some sort of dysregulation that's not due to the immune system. You can take it up to 7 days. That's actually what I was originally taught was 7 days is what people tend to do with that type of dose, but it's really not necessary to do it for 7 days. If it doesn't work after 3 days, it's probably not going to work. So, like I said, vitamin D is accumulative, and so A lot of people are really deficient in it. If you don't supplement in it with it and you live in the northern hemisphere, you probably are deficient. It's probably safer if you have your blood levels tested first, but if you live where I live in Oregon and you don't supplement with it and you don't eat tons of fish regularly, you're probably deficient in it, and it would be reasonably safe to say that you could take 5,000 IUs or more every day for about a month. You could probably take actually twice that amount and be reasonably safe. Chances are you're not going to get past 75 nanograms per milliliter from that sort of dose in 1 month. Um, and that's what they call a fill the tanks dose. That's not a maintenance dose. That's just to fill your tanks, fill up on vitamin D. It is a cumulative after all. So then you have a higher level in your blood, and you can then switch to a maintenance dose, which is going to be a lot of authorities say 500, but that's very low. I would say if you live in Oregon or where I live, or you live in the northern hemisphere, you're probably going to want to take something closer to 2,000 daily to maintain um, near around 75 nanograms per milliliter, which is where you see the most benefit and where the body naturally wants to go. The problem with this is that a lot of medical doctors are not going to see it this way. They may argue with you, and that happens. Some medical doctors may understand this, but most of them have been trained to not go up to 75 nanograms per milliliter because it's just not in their training, and it's not in their practice. So be ready for that if you do have a blood test and your doctor sees that it's 75 nanograms per milliliter or higher. They're going to be like, that's a little high. You might want to back down. And that's just kind of between you and your doctor. Personally, I would say try not to go above 75 nanograms per milliliter. But if you go a little bit above it, it probably isn't an issue whatsoever. In fact, there's a lot of benefits for that in some chronic conditions. So, I hope you learned something from this. Um, my name is Tyson Spring. I'm a clinical herbalist practicing in Portland, Oregon, and around the world through Skype online appointments. If you would like to book an appointment with me, you can do so. Or if you would like to find out more, go ahead and check out my website. It's herblife.site. There's no www, it's just simply herblife.site. Thank you.